Good afternoon, everyone. iHAS, Integrated Healthcare Access Systems, as the name suggests, we're trying to provide virtual visits by integrating information as well as real-time interactions between the patient and the medical team and caregivers, including family and professional caregivers. That's one thing I didn't try. Okay, using our virtual visits system, we would want to see that the healthcare, the way it is delivered today, would be transformed using our advanced integrated systems. And as you know, I'm not old enough to kind of tell you this, but what I hear is in the United States about 50 years back, 60 years back, the medical professionals used to come to the patient home and provide the services. And as you know, today, as we talk about the healthcare reform, that point has come back to discussions because more and more people are becoming chronically ill and probably immobile, and it may be more sensible, economical to bring the medical professionals to home, provide the services. And that's what we would like to get to. You know, in 70s, as you know, the care has moved to hospitals. From hospitals to clinic has moved to about, in 80s. And then now, I think the point of care will be moving to home as we move along in next 5-10 years. So we have developed a system. We are deployed at customers, and some of the deployments are in progress. As I come to this meeting, actually today we signed up a customer in Dallas. About the team, actually, we have both software technology as well as healthcare professionals on the team, which I'll come back to that. But in terms of market, it is like we have been discussing about healthcare reforms in the last 18 months or so nationally, or maybe longer. And the primary issue is the cost issues. And as you know, we are spending $2.4 trillion already. And that's expected to increase right now about 7% a year, and that expected to go to about 4 trillion by 2020 if we don't control it. Policy changes are happening to control that cost. Both the public and private payers are bringing in policy changes. For example, Blue Cross Blue Shield of New York has announced that they would reimburse virtual visits. It came out last week. And the difference is, like the reason why iHAS came into existence is most of these telemedicine, telehealth, what we call it, those systems are individual pieces of add-ons, whereas iHAS providing the integrated systems so that the providers and patients would be more comfortable using a system like this than add-on systems like what we have today, telehealth and telemedicine systems. The opportunity is, according to some estimates, 5 billion as of, by 2012. Population is increasing as the new things, the presentations that we have seen with mobile technology and computer technology, the population is becoming more technology savvy, want to use more advanced systems. And I think that's about 12 to 30 million as of today. And the internet usage in the country has gone up. In the last 5 years, the internet users have gone up to about 75% of the total population started using broadband in the country. And it's going to go up more because FCC is coming with new plans. So what iHAS system does is two things. One is providing virtual face-to-face visits, which is different from anything else out there in the market today. Allowing real-time interactions between the patient, caregivers, including family, and the medical professionals. Number two, which is very unique to iHAS, is the integrating all the information that you need for these virtual visits, including electronic medical records, imaging systems, whatever you need for enabling these virtual visits. As you can see in the bottom image, you could have a wound care happening at home, and the nurse could be discussing with the patient using bringing in the electronic medical records as part of that interaction. In terms of the team, myself, I come from the software, building software automation systems. Before that, I was at Harvard doing the lung physiology and so on. And Dr. Miller, who's supposed to be here, but he could not be here because his house was flooded, so he's taking care of that now. And he comes from, as a chief medical officer at a VA New England system, providing leadership at that, and also provided leadership at national level, establishing a physician productivity and efficiency office for the Secretary of Veteran Affairs. And he also served in both in public and private sectors. And we are also guided by world-class healthcare professionals. Our differentiators are basically, very simply put, the ROI using our system is about 3 months compared to the individual pieces that you may see. It is secure instead of any other systems which are owned by the vendor. Ours is owned by the provider. So our financial model is basically monthly subscriptions. Cumulatively, we generate about 130 million. And we are seeking about 5 million funding. So I'm right here in this corner. Anybody can come over and happy to share any information that you need. Thank you very much.